Now, when we speak about neutropenia, neutropenia is decrease in the neutrophils from its reference range. Causes of neutropenia is decreased bone marrow production. That is, within the bone marrow itself, the neutrophils that are produced are being decreased, or if there is an increased destruction of the circulating neutrophils within the blood, where the neutrophils has been released within the circulating neutrophils, if they are being destroyed within the circulation itself. This in some drugs and chemicals and radiation therapy procedures, destruction of your hemopoietic cells that are within your bone marrow, which causes the production of these WBC cells. When the hemopoietic cells are being destroyed due to radiation therapy or chemicals or some drugs, here it causes the decrease in bone marrow production. Most commonly it is seen in cancer chemotherapy treatment procedures. Because of the neutrophils' short lifespan, neutrophils are the first cells to decrease with chemotherapy. Your absolute neutrophil count is closely monitored during chemotherapy and adjustments are made if it drops too low. Other causes for neutropenia is acquired or hereditary defects in the hemopoietic stem cells itself, infiltration of cancer cells in the bone marrow, deficiency of vitamin B12 or folate, bacterial infections, immune disorders, that is antibody production against neutrophils. These are all the different causes for neutropenia. Another condition is pseudo-neutropenia, when there is a transient shift of circulating neutrophils to the marginated pool. So from the circulation, it goes back to the marginated pool where there is a transient shift. Over here the spelling is wrong of neutrophils. You should correct it. Causes: bacterial infection or hypersensitivity reaction. Neutrophils are the first line of defense against microorganisms. So a patient with neutropenia have a high risk of bacterial and fungal infection. The lower the absolute neutrophil count and the longer the duration of neutropenia, the greater the risk of serious infections.